Guys, welcome to Call to Mind, and today we are going to discuss outbreak of COVID-19. Now, the first thing we're going to discuss is the lockdown measures taken by the countries around the world. There everybody is being told to stay at home, so we are asking people to stay at home, and what we are trying to restrict is population movement. So, in a way, buying time and reducing the pressure on the health system, but at the same time, to slow down the spread of COVID-19. So, many countries, are using the lockdown measures to slow the spread. So, what is this lockdown? Now, we would call it as a second window of opportunity. And definitely the question is how you're going to use this second window of opportunity. Well, we what the best would be to use aggressive measures to find, isolate, test, treat, and trace, because this is the fastest way, and this is what is going to help in the end. So the bottom line is to attack the coronavirus. So question ये है कि when we are talking about is to isolate, trace, are we doing enough tracing? So many of the experts believe that India is testing below scale. Now we have to look at it as a public health system. So looking everything in mind, the kind of strategy has been pretty much built around is a focus testing, because already they don't want to completely strain the feeble public health infrastructure. So we have to keep in mind is India is building a strategy, looking at resources available, because they are limited resources and they are trying to battle is a pandemic. So on the testing front, definitely India is scaling up testing, and the government response has been that they are taking into account the scope, the need, and the capacity. But definitely India के आगे एक बहुत बड़ा challenge है, because what's going to happen is अगर infections बढ़ते हैं, and if there's an explosion of infections and there are more sick people that require hospitalization, and surely India is going to face definitely a challenging situation. So I think lockdown करने से definitely India has now time to build up, on in terms of getting the beds ready, getting the hospital infrastructure uh, ready, and also at the same time they can try to isolate and find and hunt down people with the infection. But looking at the public health system, there are some stats here where India has 8 doctors per 10,000 people, compared to 41 in Italy and 71 in Korea. There is a scarcity of isolation beds, definitely nursing staff, ventilators, and intensive care beds. Definitely, if you look at the big picture, India is definitely, trying to battle a pandemic with really limited resources. Definitely, the question is there, is India prepared for an outbreak? And over and over again, the need is definitely the need of this hour is social distancing as well as test, and test. So we need to hunt down and attack this coronavirus. This comes from definitely World Health Organization's Director General. So it's they have he has warned that this is lockdown is not the solution. You need to find, isolate, test, and treat. Now, let's talk about the herd immunity. There's a UK's coronavirus herd immunity debacle. So, what exactly is the herd immunity, and why it will not work, or why it is not right situation, especially with COVID-19. We just try to explain in a word, like it's something like vaccination. So it's a kind of an indirect protection from infectious disease that occurs when a large part of the population is vaccinated and become immune to infection. So basically, you're protecting vulnerable people such as newborns or seniors, those who are too sick to be vaccinated. Why we are discussing here, actually, while the other part of the world have been discussing on the social distancing and the lockdown, the British Prime Minister, um, at that point of time when he addressed that he would not close schools, or he would delay that uh, process, and the British government chief scientific advisor said that he hoped that the approach can build up the herd immunity to the disease. So what you're talking about is, here millions of British people, which is maybe 60%, would need to get ill and then become immune. So that's like lessen the impact of this virus. This kind of a strategy has sparked debates, and there are a lot of criticism and discussions among the professionals. Here, the big question is that we don't know much about the science of this virus. I mean, it hasn't been in our population for long enough for us to know what it does in immunological terms. I mean, we can build up the theory, and but right now, what we are facing, we have to look at the action. So, around 229 scientists from British universities said that the current strategy will put the National Health Service under additional stress and risk many more lives than necessary. If you just look at the face value, you just the herd immunity strategy seems quite wise, but the absence of coronavirus vaccines, it just seems that it's probably very high risk. So the best way to rapidly develop herd immunity is through vaccination. Why? Because a vaccine delivers a small amount into the body, and the immune system learns how to fight it off without having to get sick. But remember that we do not yet have a vaccine for coronavirus. So, if vaccines are not available and then if infection spreads, some people will develop a mild version of the disease and recover. But it is dangerous, definitely, to rely on this method to combat this, especially this kind of a virus, uh, where we need to do more research. We really don't know about this virus. Although the theory remains the same, with the herd immunity, where a lot of people develop immunity to virus, once they start developing that, eventually it will stop spreading to people who haven't yet caught it. But remember that we don't know about this virus. Health experts, they said that the approach is experimental at best and dangerous at worst. Right now, if you have to look at the big picture, it is really important on our part to, follow the basic protective measures against the new coronavirus. Wash your hands frequently, maintain social distancing, avoid touching eyes, nose, and mouth, practice respiratory hygiene, and definitely, if you have a fever, cough, and difficulty breathing, you need to seek medical care early. World Health Organization website is one of the best resource to find the latest guidelines. So with India in lockdown, definitely, we all are looking at the benefits, for the second window of opportunity. But at the same time, there is a lot of chaos going on, and this is like specifically the the migrants. They want to return home during this lockdown, and they're looking for transport. Despite lockdown, thousands gather in Anand Vihar, and what they are trying is to catch a bus to their hometown. So despite when there is a lockdown imposed across the country. Basically, the nationwide lockdown has rendered them unemployed, and subsequently, they are now desperate to return to their native places. So, as where we wanted people to stay at home and freeze where they are, now we have thousands of people gathered at Delhi Anand Vihar bus terminal to catch a bus to their hometown. So what we are looking at is a gathering with a lot many people are there. So this is a risky bet, because now it's a kind of assumption that many people will be infected regardless of what the authorities right now are looking at. Like the aim was to stop the epidemic, and then we were trying to looking at the health infrastructure and or building up the health infrastructure so that it can absorb the peak of the epidemic and then cure the worst cases. Well, while we the way now things have turned up, do you think that this would be in a way um, uh, going towards the herd immunity? Because that relies on the fact that those who survive the virus can no longer be infected. It looks like, the various governments around the world are tackling the crisis with a lot of different ideas and the trial and the error approach. And to start with, there was no idea, or there was, not looking at to try to create herd immunity, but it looks like more of a side effect of lockdown, and because lockdown was mostly preferred because it was directed at slowing the outbreak to a more a manageable rate. So although the idea where you allow the population to become infected in a bid to achieve herd immunity looks like it's a deadly strategy, but at the same time, what has happened at with the Anand Vihar bus terminal, where a lot many people gathered together, so we have to watch out. When we have enough data in days to come, looking at different perspectives. It looks like playing with the fire, but because it would have been lockdown was much more preferred because at slowing the outbreak to a manageable rate. So right now, what's going on at Anand Vihar bus terminal is more like playing with fire. So in the days to come, surely we'll look at the data. And while I would just say that follow the best resource, which is the World Health Organization. Follow the guidelines and stay at home.